I'm Rajiv Tandon. I'm a professor of psychiatry at Western Michigan University, home of Stryker School of Medicine. And I've been working in the area of schizophrenia for about the past 45 plus years, trying to better understand the condition, researching primarily its clinical manifestations, the neurobiology, and more effective treatments. As I've been working in this field, one of the things that, has struck me is despite the advances we've made in better understanding, in developing more effective treatments, less than 15% of persons with schizophrenia even today are fully independent, are employed, and high mortality. On average, they die about 10 to 15 years earlier than the general population. There are significant deficits in their social relationships. And so, as I think about the objective of what we as mental health practitioners aspire to, we want to ensure that persons with schizophrenia lead the most productive, meaningful lives that they can. And as we explore that, we assembled a group of 8 experts, 6 psychiatrists, 2 psychologists from across the USA and Europe. And we decided to explore why there are challenges in terms of functional recovery in persons with schizophrenia. What tools do we have? Now, since there have been a number of publications, a number of educational products with regards to the pharmacological treatment of schizophrenia, we decided to take a more detailed look at psychosocial interventions and how they can be better harnessed, what we know about them, and how we can better utilize them to promote recovery in persons with schizophrenia. And we first explored what drives functional impairment in schizophrenia. What are the elements, factors that underlie functional impairment in persons with schizophrenia? And we recognize that there are a whole range of different drivers. There are some drivers of functional impairment that are intrinsic to the condition of schizophrenia, that are part of its manifestations. Different kinds of symptoms, for example, cognitive symptoms, deficits, negative symptoms, refractory positive symptoms, diminished person insight, for example. There are drivers associated with behaviors that occur in the context of schizophrenia, such as poor treatment adherence, substance use, although that can also be considered a comorbidity. Some of the consequences and associated comorbidities, such as depressive symptoms, and then defeatist beliefs that might accompany the difficulties that persons with schizophrenia experience in living more productive lives. Loneliness that in turn impairs the ability of individuals to function more effectively and to participate more effectively in society. And then there are social contextual drivers. In addition to that, our treatments, although they're effective in a variety of different ways, they also have their drawbacks, if you will, side effects of medications, for example, other costs of the interventions that we utilize. And that, in turn, reduces the functional capacity of individuals with schizophrenia. And then there are certain societal barriers to persons with schizophrenia living more effectively in society. So we explored what the drivers of these functional impairments might be in persons with schizophrenia. Then we explored the range of psychosocial interventions that might be useful in terms of targeting each of these deficits, each of these drivers of functional impairment in schizophrenia. And we conducted a detailed review of each of these psychosocial interventions, psychotherapy, social supports, a whole range of them. and we examined exactly what they targeted, which of these functional impairments or what combination of functional impairments they effectively targeted, what the evidence base was for their effectiveness. And with that, we then moved on to a consideration of, okay, so this is what we know. This is the best we can do at this time. And even as there are some limitations in the effectiveness of these psychosocial tools that we have to help persons with schizophrenia, they are effective, but they're not being utilized. And so we developed some guidelines for actually utilizing these psychosocial treatments more effectively in terms of providing individualized treatment to persons with schizophrenia. Our basic conclusions were, A, there is significant functional impairment in persons with schizophrenia, and they are unable to lead fully productive, meaningful lives that they would like to lead because of a whole range of factors. And there are psychosocial treatments that are quite effective, but they're not being utilized in terms of helping persons with schizophrenia. And these psychosocial interventions include cognitive behavior therapy, cognitive remediation, social skills training, employment-focused therapy, and a whole range of others that are effective in improving functional outcomes across multiple domains, and yet they're not being utilized. Now, pharmacological treatment is still the foundation of the treatment of schizophrenia. So it's critical that there be effective, individualized, measurement-based pharmacological treatment. But in addition to that, we need to utilize psychosocial treatment strategies to helping persons with schizophrenia lead more productive lives. And we provide guidance with regards to how to utilize them, how to access them, how to utilize them, and actually incorporate them into our treatment planning for persons with schizophrenia. There is an extensive review that I would draw your attention to, which the 8 of us who work on this endeavor have put together. Psychosocial Intervention and Functional Recovery in Schizophrenia, Realizing Opportunities Today, in the Journal of Clinical Psychiatry. I want to thank you all for your attention as we all strive to improve the lives of persons with schizophrenia. Thank you.